Tonight, as part of our monthly AARP-sponsored segment that highlights issues important to older adults in Arizona, we look at a program called Neighbors Helping Neighbors. This program from the Tempe Community Action Agency, or TCAA, encourages volunteers to help seniors in the community and assist them with their health, social isolation, and safety. Joining us to tell us more about this program is Carrie Aranda, Director of Mission Advancement at TCAA. Welcome. Thank you for being here.
Thank you.
I hate to ask the most basic question of all, but Neighbors Helping Neighbors, how did it start, and what's the actual goal of it?
So Neighbors Helping Neighbors actually started as a separate organization in Tempe to serve the senior population, to connect them to the community. TCAA partnered with them and then eventually took them under our umbrella and has made it one of our programs.
Okay, so how much of it is volunteer driven? I know there's healthcare involved as well. Are there trained healthcare workers in addition to community volunteers? How does all that work?
So our Neighbors Helping Neighbors program is staffed with community health workers. So there are people from the community who know the community, who are trusted by the community, that can connect folks to those kind of complex systems of benefits and healthcare, especially those that are low income and maybe kind of separated from a primary care doctor, maybe don't understand how to access their benefits, or how to pick up prescriptions, what their prescriptions are for, how to organize all of that. Just another way of making sure that that bridge between a community member and the healthcare system exists. And then once we are sure that senior is safe and on the road to being a little bit more independent, we then match them with a volunteer that provides rides, companionship, whatever that senior might need. And we match based on the needs of the volunteer and the needs of the senior.
So I'm wondering, when we're in a position like this right now, and we're seeing things change and more older people and people are living longer, how important is it for something like this to be in place even more so than it ever was before, Neighbors Helping Neighbors? The fact that it just seems like there's more of a need generally in the community for this sort of service.
There is, and we are seeing seniors in need in all of our programs across TCAA, whether it's Meals on Wheels, Neighbors Helping Neighbors, our senior center lunches that we provide, even in our food pantry, and we deliver food boxes to seniors. We are also seeing them as the fastest rising demographic in shelter. We do run a shelter, and we're seeing more and more seniors in shelter. As the population grows older and fixed incomes become less compared to inflation and higher rent prices, we are seeing more seniors in need, and it does become a very critical need in our community.
And how does this play a role in the number of people who'd like to be able to stay in their own homes, aging in place, for example? How much does this play into that, and how vital is it?
That's the goal of this program, is to make sure that seniors are aging safely in place, so that they have the tools, they have the support that they need to safely age in their homes. And the Claris tablet is one way that we do that. We have 30 of these that are out with seniors, and they're very simple. They're set up with big buttons on the screen. We teach them how to use it. They come with their own internet so that they're not dependent on somebody having internet in their home. And it's a way for them to communicate with our staff. It's a way that they can communicate with family and friends, because we can do things like FaceTime, and we teach them how to use it, and we set up a tablet based on the senior's need. If a senior has a particular church and they want the church's website saved on there, we can add that as a button that they can then see service times and what's going on in their community.
Now that's exciting, because and not to joke about somebody who spent on TV years ago, but it's not like one of these buttons, oh, I've fallen and I can't get up. This is actually so many other elements. That's very exciting.
Correct. And it's a way to kind of reduce that isolation. And we can add apps, they can download games, they can play games. In fact, one of the favorite apps is TikTok. And so they're learning not only the technology, but it's connecting them. A lot of them, their families don't live here. They can then FaceTime, they can email, they can do all of that, and we help them learn how to do that.
So Carrie, last question for you. So this can involve anything from having meal preparation or meal assistance, but also if there's, frankly, a health situation that needs to be taken care of very quickly, by using the tablet, that can really connect all these things.
It does, and our community health workers check in. If they're part of our Meals on Wheels, our drivers are there driver's there every weekday delivering a meal. We do catch a lot of things for seniors, whether it's a memory issue, a fall. We had a senior that was going to speak at an event of ours. The community health worker went to pick her up, and she was dizzy, so we were able to then get her medical attention.
Well, it's exciting. Thank you for being here. And obviously,
Thank you.
Tempe does a tremendous amount of great work when it comes to this.
Thank
Thanks
you.
again. Good luck.
Thanks.